Hi, you guys. Welcome back for our daily practice questions. It is day 140 and day 10 of our Pharm series. But as always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. And I am doing something for today for you guys for the first 10 people. I'm actually extending this. You probably saw last week sometime. I allotted for you guys to get my full review video with the downloadable workbook associated with it for $97. It's typically provided in a whole class setup and all of the additional weeks of review and practice questions. But I'm letting you get all of that and you can use it as a self-paced review. But some of you reached out as you missed the sale last week. So I will put it up here. I'll allow 10 people and it'll be linked in the description. After 10 people get it and you're no longer able to access it, just know that it's because it automatically cuts off once the limit has been reached. So if it's blocking you out, that's what happened. But thank me later. I'm giving y'all 10 more additional slots. But y'all know, before we get into the questions, I just want to go over my disclaimer. There's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. And I say this all the time, but my reason for saying this is because I know guidelines change, but until the test changes, I'm teaching you on what you need to know for the current test that is out so that you can be successful on the exam, okay? Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. And as always, make sure you hit the subscribe button so you don't miss any of my videos. All right, question number one. A 25-year-old woman with intermittent asthma has shortness of breath 1 to 2 times per month and has occasional nighttime cough. Spirometry is normal. What is the most appropriate treatment according to current guidelines? Is it A, no treatment needed? Is it B, albuterol inhaler as needed? Is it C, low dose ICS and formoterol as needed? Or is it D, a daily low dose ICS with a SABA as needed? Take a moment and tell me what you got, y'all. All right, so y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here, the stem of the question states, what is the most appropriate treatment according to current guidelines? And I always tell y'all, if they're asking for the treatment, you need to run it back and see if a diagnosis has been provided. And here it does say that we have someone with intermittent asthma. She's having shortness of breath 1 to 2 times per month and has occasional nighttime cough. So, what do we prescribe during that intermittent asthma? And C is your best answer. Remember, based off of GINA guidelines, stages 1 and 2, we treat with a low dose ICS plus formoterol combo inhaler as needed, okay? So, on a PRN basis. All right, question number two. A 40-year-old man with asthma reports symptoms most days of the week and uses his rescue inhaler about 3 to 4 times per week. He has nighttime awakenings 2 to 3 times per month. What is the most appropriate controller therapy? Is it A, albuterol as needed only? Is it B, a low dose ICS and formoterol as needed? Is it C, a daily low dose ICS and formoterol plus PRN use? Or is it D, a daily high dose ICS with a LABA? Take a moment and tell me what you got, y'all. All right, so stem of the question here states, what is the most appropriate controller therapy? All right, so when we're talking controller therapy, we're talking about asthma. And this is stage 3 asthma based on the presentation with the patient having to need to use their rescue inhaler on most days of the week. They're having about 3 to 4 times per week that they're needing it. And they're having nighttime awakenings 2 to 3 times per month. Okay, so make sure you're familiar with your symptoms with asthma. If you are unaware, go check out my asthma video where we kind of talk and walk through those. But I want to stay focused on the treatment for this Pharm series. But when we're talking controller therapy, remember that we have our alternate therapies. We have rescue therapies, aka your reliever, and then your controller therapy, right? So in stage three, this is where we go from just giving them the low dose ICS plus formoterol as needed, but now we do it on a daily regimen as well. So they get it every day and have it PRN. So they call it MART, MART. It's a maintenance and reliever therapy, okay? So C is your best answer. Make sure y'all know y'all GINA guidelines. And then lastly, question number three. A 32-year-old patient with mild asthma has been using low-dose ICS plus formoterol as needed. Over the past month, she reports increased daytime symptoms and is using her inhaler several times per week. What is the next best step in management? Is it A, increase to a high-dose ICS and formoterol? Is it B, add a leukotriene receptor antagonist? Is it C, switch to PRN albuterol only? Or is it D, begin a daily low-dose ICS and formoterol with the PRN use? Take a moment and tell me what you got. All right, so stem of the question here. What is the next best step in management? And again, this is just simply asking you treatment. So this patient has mild asthma. They have a history of mild asthma and they've been using their low dose ICS and formoterol as needed. So mild, intermittent, those are the first and second stages where we're using that ICS and formoterol as needed. But remembering with GINA guidelines, and especially asthma, we follow the patient's symptoms. So if their symptoms are increased and they're having to utilize this more, that means they need more coverage. So we're going to bump up to stage three based off of how often these symptoms are occurring. So D is your best answer. You want to make sure that you're starting them on that daily low dose and ICS and formoterol combo inhaler daily, as well as on continuing that as needed basis. Okay. So I wanted to give you on question two and three different scenarios, but showing you how you would utilize these or change and adjust the therapies based on different presentations, but it's still bumping up the lines. You know what I mean? So Gina, again, one and two, in those first stages, we're doing that low dose combo inhaler PRN, which is your ICS and your formoterol. Remembering formoterol is a LABA. Stage three, we still use that combo inhaler ICS and formoterol, but it's now every day and not just PRN. Then you're going to bump up to now from a low dose to a medium dose every day. And then in the last stage, you can bump up from that medium dose to a high dose every day, or you can add in a LAMA with the medium dose. Okay. So it just goes up the stairs. Take a look at that chart. If you would like the chart, let me know. I can send it to you. But remember that you're just going up the stair steps. All right. All right, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. Again, if you are looking to grab the video courses of what everybody has been talking about has been the most common thing that they've used to pass boards that I offered on last week. I have that linked in the description. Grab it while it lasts. And make sure y'all meet me back here. And if you need any of the other resources that I offer, as always, feel free to reach out to the nursing studio. You can give us a call at 803-400-6864 or shoot a text message to this number, or you can shoot an email to the nursing studio, the number one at gmail.com. Everything that I offer is linked in the bio of this channel. But as always, if you're looking to book any of my one-on-one sessions, custom packages or plans, or question analysis sessions, I always say either call, text, or email, as I prefer to speak with you first so that I can gauge what you truly need to make sure you're booking the appropriate session type. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.